living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Tinnitus is one of the most common health conditions in the country, with more than 50 million Americans experiencing its symptoms every day. It can cause underlying health conditions and put patients at risk. The good news, there are treatment options. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Sarah Medley, your host. Stay tuned. We'll be back to talk about tinnitus and treatment options. Welcome back to Healthy Living for Life. I'm joined today by Dr. Ruby Zubrod, Doctor of Audiology at Brandt Audiology and Tinnitus in Cheyenne, Wyoming. Thank you so much for being with us, Doctor.
Thank you for having me.
So first, out of the gate, tomato or tomato, tinnitus or tinnitus. Help us pronounce that word.
So honestly, both are correct. In the professional world, most of us say tinnitus, and most lay people say tinnitus, but we will use tinnitus for the purpose of talking about it today.
Excellent. Thank you for that clarification, for sure. All right, so first question I want to ask is, give us an overview of what tinnitus is, and how common is it?
It's extremely common, and honestly, it's a fancy name for any sound that is present for no good reason. So the most common people recognize it as is ringing in the ears. But what a lot of people don't think about is it's more than ringing. Some people get actual ringing, some people have a buzzing, some people have a whooshing noise. Sometimes it's actually more musical than an actual ring. So it has a whole variety. It's one big word to describe all of those sounds that people hear when there really isn't a sound to hear.
Is tinnitus a disease then?
So yes, it does actually fall under the disease category. I do have to say, I think that makes it sound really, really scary. It unfortunately is not something that is truly curable. We can treat the symptoms, but once you have it, it's usually there to stay.
You talked about different types of ringing. Are there different types of tinnitus, or is that one and the same?
It's one and the same. Like I said, the big name is tinnitus, but it presents in so many different fashions. And it can be continuous, where you wake up in the morning and it never goes away. More often, it's intermittent, where you are going along and all of a sudden you almost feel like your ears shut down for a moment and you hear a ringing for a few seconds and then it goes away. But it can present at different volumes, at different intensities, different times of the day. And each person can have different types of tinnitus too. So just because you're hearing your sound one day as a ring, the next day it could present as a buzz.
How do our ears create that sound? And is it possible for others that are close to us, in proximity, to actually hear it?
That's a great question. It does get loud enough for some people that they swear that other people can hear it. And the answer is no, no one else can hear it but the person hearing it. But it's important for people to know that when they have it, they're not going crazy. It is really there because no one else can hear it. It almost makes patients go, I don't want to say anything because somebody's going to think I need to go get an extra evaluation, but it is real and it is there. What causes it is in your cochlea, you have hair cells. As your hair cells break off, it creates hearing loss. But it also now leaves an open nerve ending in the cochlea that can be stimulated for a variety of things. So sound comes in and it goes into the cochlea, which is fluid filled. That fluid moves, which moves the hair cells, and the hair cells send the signal going to the brain. Once those hair cells have broken off, we still have a nerve ending that is open and exposed. So sound comes in, moves that fluid like it's supposed to, but now it's stimulating a nerve that's not working because that hair cell is no longer functioning. So it creates a neural response to go to the brain, but now that it does not have the correct meaning to it, the brain doesn't know what to do with it. Hence this noise. The noise is just there.
Gosh, I did not know that. Very informative. So are there other health conditions that can cause tinnitus or worsen symptoms if one has it? And what are they?
Yes, several. So the most, if we're talking about actual illnesses, the most common is diabetes. But overall health concerns, so going through cancer treatments, going through pain management, anytime your body is not functioning at par, it can create or make the tinnitus worse. So some of the most common aggravators of tinnitus are caffeine, tobacco, salt, alcohol, some medications. The one universal aggravator of tinnitus is stress, and stress of any sort. So we all recognize stress, like I've had a bad day at work, I'm tired of dealing with my coworkers, I just want to go home and be away from the world. The stress we forget about is the stress of, I didn't get a good night's sleep last night, so my body is not working the way it should. I feel a cold coming on, which means my body is under stress. I am in chronic pain. That is stress on the system. Any kind of stress on the system creates an increase of tinnitus for a lot of patients.
Well, you're really making me nervous right now because I think I suffer from all those things, including lack of sleep. So, yeah. So we've got about 20 seconds left. We're going to talk about, going forward, some other treatment modalities that we might take. So can you just give us the name of one, a treatment?
Honestly, the most common treatment for tinnitus is hearing aids or amplification of some sort.
Okay, very good. Well, we're going to need to take a break, but when we come back, we're going to talk about what we all might be doing to increase our risk of tinnitus and steps we all can take to prevent it. So don't go away, stay tuned. Welcome back. We are still talking with Dr. Ruby Zubrod about tinnitus. And so I'm going to follow on with the end of our first segment in which we talked about stress and sleepless nights, etc., having an impact on tinnitus. So, that makes me concerned because certainly I've experienced that, and I'm sure a lot of my colleagues have as well. So if I had tinnitus and I got more sleep and I started meditating, and so my stress levels went down, will the severity of the symptoms lessen?
In most patients, yes. That is one of our most common recommendations for a coping factor, especially if it's, say, the middle of the day, which is not uncommon for it to increase because of life and stress. One of the most common things I tell people is go take 10 minutes and do some breathing exercises. If you're at an office and you can't get alone, go sit in the bathroom for 10 minutes, but just give yourself some time to relax, bring the blood pressure down, get yourself back under control, and you will find in most cases the tinnitus is a lot more manageable at that point.
Good tips. What increases a person's risk for developing tinnitus?
So a lot of it is health factors. The list is so long, it's hard to manage, to name all of them. But, if you're healthy, you're just not as healthy as you want to be. That tends to be a most common risk factor. So when I mentioned the caffeine and the tobacco and the alcohol and all of those things, you think about it, those are our coping mechanisms to get through the day when we're not up to par. So it kind of goes hand in hand. Now I'm talking about, drinking pots of coffee a day. If you have a couple of cups of coffee a day, that's not going to aggravate your tinnitus. If you're somebody who drinks 2 or 3 pots of coffee a day, that potentially is an aggravator. So you do have to, look at how much you're intaking. When it comes to medicine, you have to talk to your doctor. If your doctor gives you a new medicine and you notice your ears are ringing more than they did before, go talk to your doctor. Now, the doctor may say, I'm sorry, but this medicine is very important, so we're going to have to deal with it. But a lot of times they can even just adjust the dose a little bit, and that can make a big difference on a way to manage that tinnitus too.
So when I think about hearing, loud noises can impact or affect our hearing negatively. What about loud noises causing tinnitus?
Absolutely. How many times have you gone to a concert and at the end of the night, your ears feel a little bit they're a little plugged, there's some pressure in there, and you're hearing your ears ring? Well, you got 2 things going on there. You did cause hearing loss and you caused hearing damage at that point. Your tinnitus is worse at the moment because your system is on overload and it has to recover a little bit. Most of the time, if it's an excessively loud noise like that situation, it'll start to go back to normal levels within about 24 hours. However, sometimes it does increase your tinnitus and it doesn't always go back to normal. So it is important to wear hearing protection when you're around loud noises, not just to protect your hearing.
Oftentimes, when we talk about health and prevention, we think about doing more exercise and our diet, and they come into play in terms of healthy living. So what about those factors with tinnitus? Do they help?
They do. Healthy eating, that makes our bodies work better. If we circle back to that whole stress factor, when we are living a healthy lifestyle, our body is under less stress, which usually in turn allows for less tinnitus. Now, there's one caveat to this about exercise. It's not uncommon to experience an increased tinnitus when you're exercising, because as your blood flow increases, the blood flow to the ear increases, which adds a little bit more stress to the ear. So you can get some increased tinnitus while you're exercising. That doesn't mean you shouldn't not exercise. It's okay if that happens, because once you're done exercising and your rhythms go back to normal, your tinnitus will go back to its levels that you had before exercising as well. So that's one. I've had patients say, I'm worried to exercise because it's making my tinnitus worse. And that's a temporary moment. So don't not exercise because you're hearing ringing in your ears.
What about tinnitus and men and women? Do women get tinnitus more than men, or the reverse?
In general, both. That's a good question. I would have to actually look up statistics. It's been a while since I've seen an actual research paper on it, but it both affects men and women. I think men tend to complain a little bit more often than women, just because in general, women tend to go with the flow a little bit better. The other thing is hearing loss does not cause tinnitus, and tinnitus doesn't cause hearing loss. But like I talked about, they start from the same source. In general, men have more hearing loss in the range that's going to equate to tinnitus than women. So you kind of have the twofold answer there. Women are not immune, but just general genetics, it does tend to be a little bit more common in men.
And we've got just about 20 seconds left. What about age? Young people get it more than older, or not?
It's more noticeable as you get older. You can have it in your teenage years, your 20-year-old years, 20s, 30s, but usually at that point, it just comes and goes. The long-lasting tinnitus that bother people tend to be when you're older.
Thank you so much, Doctor. And we're going to have to pause and take another break, but when we come back, we're going to be talking about getting to your doctor, receiving the diagnosis, and what other tips we might need to know about. Stay tuned. Welcome back. Dr. Zubrod is still with us, and we're learning about tinnitus. So thank you again.
Of course.
We talked about symptoms earlier in the episode. So when do we know it's time to go see a doctor if you're experiencing those symptoms, and who do we go see?
So if you're getting the random tinnitus where it just rings for a few seconds and it goes away, that's very normal. That's probably, you're always welcome to go see your primary care physician, but that's not where you're going to necessarily need to do that piece. When you get to a point where it's causing frustration, it's causing communication issues, it's keeping you up at night, it's adding stress and annoyance, that's when it's time. The first step, they can happen congruently, actually. So you need to see an audiologist as well as your primary care physician. Your primary care physician needs to make sure your blood pressure is under control, your thyroid is under control. They need to make sure that medically your body's functioning as good as possible. At the same time, you need to see a doctor of audiology. They're the ones that are going to do a hearing test and look at the tinnitus. Now, it is important when you're talking about doctors of audiology, not all of them work with tinnitus. Some of them just do the audiological side. So, ask the office when you're making an appointment, what do they do for tinnitus? Do they actually do a tinnitus evaluation? And do they do treatments for tinnitus? Because not all offices are the same in that regards.
So if I'm experiencing tinnitus and I go see you, what would you do? What would I expect?
So in our office, we do a complete audiological evaluation, which is a hearing test. And then we actually test the tinnitus and put some numbers to it. So because it is individual for everybody, I'm just kind of quantifying how loud it is, some frequency, pitch matching, but that gives us a lot better idea of how much it is impacting your life. There's a couple of questionnaires we have you fill out. And then once we get the whole picture put together, then we look at what the best treatment option for you is. It may be as simple as just some counseling and me telling you you're okay. Because of course, when our brain doesn't know what's wrong with us, it panics. So our ears are ringing, we don't know what's going on. Our brain thinks, oh my goodness, I have a tumor. We always go to the worst case scenario. So if I can say, no, you're physically fine, you have some ringing and here's some ways to manage it, that works for a lot of patients. If that's not enough, then we look into different treatment options, which sometimes is included. You have chiropractic care at times. Some people get benefit from acupuncture, counseling, meditating, as well as amplification, which means hearing aids. Because when we get you the sound back that you're missing, you are not going to notice the ringing nearly as much. So at that point, we're treating your hearing loss and we're treating your tinnitus in the same device.
I think I know the answer to this question, but I'm going to ask it anyway. Can tinnitus be cured?
Unfortunately, it is not curable. We can treat the symptoms, we can give you coping mechanisms, but once it's there, it does not go away.
And so really, there is no medicine that is going to help much with symptoms. Is that a true statement?
That is a true statement. As I tell my patients, I don't have a shot I can give you. I don't have medicine. I can't go in there and replace the system. There are some over-the-counter herbal supplements that some people say help. Honestly, it's a case-by-case scenario, and that's where you should talk to your primary care physician before you start taking anything. Although they're herbal supplements, and that tends to be safer, it still can interact with some of your other medicines. So don't start taking something without talking to your primary care doctor first.
Important tip for sure. Let's switch gears a bit and talk about injuries. So I've read that injuries can trigger tinnitus. Is that true? And if so, what can we do to help prevent that?
Absolutely, and head injuries are the most common. I should say head and neck injuries are the most common to cause that tinnitus, and it's just the stress on the system. One thing is you use the tinnitus to help you know if I need to get evaluated. If you're in a car accident and your muscles are all tense and your ears have rung or have started ringing, you need to go get that evaluated. That is one scenario where once we get those symptoms under control, sometimes the tinnitus can get diminished, almost gone, because it is such a cause and effect type situation. But at that point, the tinnitus actually helps you know you need to go follow up and not ignore what's going on with your body.
What about wax buildup? Talk about that.
Wax is a fun topic in my office. No, you should not use a Q-tip. But yes, if your ears are impacted with wax, that can increase tinnitus as well. The nice one on that one is as soon as I get the wax out of your ears, your tinnitus will go back down to normal levels. So that one is a happy day in my office. Q-tips, we always get this question, so I'll just throw it out now. Why don't you use Q-tips? Because weren't they made for the ear? The Q-tips do not pull wax out. It actually pushes your wax down in your canal, and then it ends up getting so built up that you have to come in and I have to take it out with my curette or suction.
Gosh, that is an important piece of information. I know many people that use Q-tips. Thank you so much. That time went fast, Doctor. We really appreciate you. And thank you so much to our viewers for staying with us. We hope you'll join us again next week. And until then, stay fit, stay well, stay healthy for life with Healthy Living for Life. Take care, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.